Hello and welcome to Health and Wellbeing on Astro Radio and Television. I am Lois Sambu. Public health is an important element of national security, which functions to provide adequate and timely medical care for the populace. In order to achieve this, it is therefore imperative for every country to have a strong healthcare system. Today, we shall be discussing the Nigerian healthcare system with Dr. Adebi Olusegun, who is the Secretary of the Association of Resident Doctors, Federal Medical Center, Abuja chapter. Dr. Olusegun, you're welcome.
Thank you for having me, Louis.
And it's nice having you here. Well, we're going to go on a short break, and when we return, our discussion will commence. Do stay with us.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803-705-1784, or Dr. Doris John, 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Welcome back, and thank you for staying with us. Before we went on the break, I said we will be talking about the Nigerian healthcare system and so many challenges that it is faced with. Well, it is no news that the Nigerian healthcare system is suffering some major shortfalls with COVID-19 pandemic and incessant strikes that are currently leading. And this has actually become a source of concern to us as citizens in the country. What do you have to say about this?
The problems facing the healthcare delivery system in the country, if you look at it from the angle of COVID-19 or from the angle of incessant strikes or from the angle of healthcare workers departing the country for greener pastures, they all have one thing in common that ties them together. That's the Nigerian government. No matter how you look at it, it all boils down to one thing: lack of commitment on the part of government towards developing our healthcare delivery system. No matter how we cloak it, no matter how we paint it, that's the baseline. That's what it boils down to. Because, for example, look at a country like the United Kingdom. Look at a country like the United States. Look at how the weight of COVID-19 is telling on their healthcare delivery system. Those are standard systems. Now, it gives you an idea of what we are pushing the healthcare delivery system in Nigeria, what we are going through, what we are being exposed to. On normal day, even without COVID-19, you go into, and I'm talking about a tertiary institution, not a state-run hospital, not a primary healthcare center. You go into a tertiary institution, you go into the emergency inlet of a tertiary institution, and you don't have something as basic as latex gloves to attend to patients with. There are some emergency points in the country that have not more than one cylinder of oxygen to manage a patient. I've been in a hospital before in Abuja. We are not talking about places outside the Federal Capital Territory. In Abuja, a federal-run hospital, a federal-owned hospital, one of the federal staff hospitals. A patient was brought in. There was no, the patient needed resuscitation. Resuscitation was ongoing before it was realized there was no oxygen to continue resuscitating the patient. Patient had to be moved in an ambulance to another center. Something as basic as that. Then we are now talking about COVID-19. A healthcare system that has been ravaged that way. How do you think we will cope with COVID-19? And that's why we see what we are saying. What the progress we have made so far with respect to COVID-19, I believe is divine.
It has to be.
It has to be divine. There's no other explanation, because if you base it on how we do things, our level of preparedness, you put your mind on it, and the picture your mind paints for you is a disaster. But for some reason, God loves Nigeria. That's why we seem to be making progress, despite all the hurdles we face day in, day out. With respect to the incessant strike by medical professionals, it still boils down to the same thing: lack of commitment on the part of government. Members of the public, there are things they don't understand. All they see is doctors went on strike 4 or 5 times in the past 2 years, not realizing that the first strike, the reason for the first strike, is still the reason for the 5th strike. Because we come back from these strikes because government makes promises. We sign all sorts of things. They give it different names. First, it was memorandum of terms of settlement. We'll sign it. We'll come back. They give us a timeline when things will be sorted. And these things we are requesting for are things that would make the healthcare delivery system better. Well-equipped hospitals, better welfare situation for health workers. Because welfare for health workers becomes important because whether you like it or not, people are leaving the country. And you can't blame them. We are human beings. Even animals behave like that, because you put a cow in a place. Let's say this is a field. You put a cow here. It starts eating grass. By the time that grass finishes, the cow moves on to greener pastures. Not now related to humans that think. Whether you like it or not, good example. I have a junior brother. He's a doctor too. He's in Saudi Arabia. There's no time we talk on the phone that he doesn't ask me, "What are you still doing in this country?" When he went to Saudi Arabia, the week after he went, he called me and he said, "What we are practicing in this country is herbal medicine. Based on the level of advancement, the equipment he was exposed to, he told me it's herbal medicine." And it's so sad. My HOD at work, while he was HOD, left and went to Saudi Arabia. It tells you nobody is exempt. There was this, I think a few weeks ago, last week or so, the Saudi government sent people here to recruit doctors. They were not just recruiting any type of doctors. They were recruiting consultants and specialists. They were taking the best of the best. And our country still has no response to that. And we are talking about how we want the healthcare delivery system to get better. How can it get better? The key to this system getting better is the government. Once the government refuses to be committed to making the system better, no matter what we do, the system won't get better. And the key problem here is this. When government officials have the chance to travel outside the country once they have a headache to go and sort themselves out, nobody cares about the healthcare delivery system because it doesn't affect them in any way. The only time in recent memory that things got procured and placed in government hospitals and all that was when COVID-19 caused the lockdown. And these government officials realized they were not traveling anywhere. We were all stuck in this same country with that same healthcare delivery system. All of a sudden, ventilators started popping up from nowhere. Hospitals started getting ventilators. Money was released for several federal hospitals to build 10-bedded intensive care units. Where was all this before? And all of a sudden now borders have opened, people can travel again. All these projects they are winding down. Nobody pays attention to them anymore. And that tells you the key thing is this: the members, people in government, see themselves alone, forget why they were put in those positions, to take care of Nigerians, to see to the welfare of Nigerians. How do you see to the welfare of a people if not ensuring that health is optimal? Like I said, if there is no commitment on the part of the government, we are fighting a lost battle.
Well, I'd like us to talk about the primary healthcare system, because I know the crux of every healthcare system boils down to its primary health. And that's one thing that I see hasn't been given so much attention. But what can be done to revamp the primary healthcare system?
In all honesty, it pains to say things like this, but without sugarcoating anything, without painting anything nice for anybody, our primary healthcare system is non-existent. I tell you that with all confidence. I'm a doctor, I'm a healthcare worker. I have worked as a house officer, I've worked as a NYSC personnel. I have been practicing for about 12 years, give or take now. I have worked in different parts of the country. I've worked in Kwara State, I've worked in Federal Medical Center, Bida, I've worked in Jos, I've worked here in Abuja, I've worked in Ogun State. I have been to I've worked in villages, I've worked on army cantonments. I have seen how things are everywhere. Our primary healthcare delivery system is non-existent. Because the way things work is this. Not everybody can be attended to at a tertiary center. The primary healthcare center is closest to the people. That's the first point of call. You are seen there, they manage you. Regular cases, malaria, gastroenteritis to an extent, typhoid, respiratory tract infections to an extent. You're managed there. If there is a bit of a problem or something they can't handle, or the condition you present with is more than they are capable of handling, you are referred to a tertiary institution. That's where you are now giving, the way we Nigerians look at it, world-class type of treatment. But what we do in our tertiary institutions now is what should be done at the primary healthcare centers. That is because the primary healthcare centers are non-existent. When I was a copper, I was the only doctor in a primary healthcare center where I was, in Ikene, in Ogun State. I was the only doctor.
There wasn't any doctor apart from you?
Apart from me, there was nobody. And it's like that till today. It's like that in different primary healthcare centers across the country. I was a copper then. My experience was limited. My exposure was limited. And I was placed there on my own, unsupervised. Just allow that sink in. Consider your elderly family members living in villages. Consider that picture, and that copper who is alone, who is unsupervised, is the person that is taking care of them. And that copper represents our primary healthcare system in the country. That's the easiest way I can break it down for Nigerians to understand what we are facing.
Now, I'd like us to talk more on this, because when you say there was no doctor, does that mean that no doctor is actually posted to that kind of place? Or do we have a situation where doctors are posted to villages but don't want to stay in villages, so find their ways back to the urban cities?
Nobody wants to stay in a village if you are not properly motivated. It's normal human behavior. If you had the choice to stay in Abuja or stay in Nasarawa State, you would want to stay in Abuja. Abuja is more urban. But the thing is this: if I'm going to pick a place to work in Nasarawa State, between Nasarawa State or Abuja, and I am given incentives to stay in Nasarawa State, I would stay in Nasarawa State. When I was doing my internship, my house job in Federal Medical Center, Bida, half of the people we entered FMC Bida together left because it wasn't an urban center. A lot of them came to Gwagwalada, UAT, University of Abuja Teaching to Gwagwalada. A lot of them came to National Hospital. A lot of them came to FMC Kefi, leaving the place like it's a rural place. It's not urban. They can't stay and all that. But the thing is this: do you know that as a house officer, the salary I was getting as a house officer in FMC Bida was about 20 to 30K short what a house officer in National Hospital in Abuja was getting. So that alone would make you want to leave a rural center and come to an urban center. It just, our priorities are wrong in the country. You want people to come to rural centers, you want people to man these primary healthcare centers, but you don't do anything to encourage anybody to come to stay in those places. So in as much as this system is the same way it is, People will always live. No matter who you post there, they will find a way to live. And considering how the country is based on corruption and based on nepotism and who you know and all that, people will always find a way to get posted out.
Places. Well, you started talking about something about someone that already left to Saudi Arabia and then so many other people that were planning to leave. I'd like us to talk about that, but that will be when we come back from this short break. When we come back from this short break, we will discuss the exodus of medical doctors leaving this country. Do stay with us.
Sir, can you please give us the permission to search you? You can go.
Is this a movie? If it happened...
Officer, I beg carry and go station. When our Oga come, you come meet am for there.
Hey, Mr. Man, I cannot do that.
Tell your Oga to come to our station when he returns.
Am I in a movie? If it happen,
Mama, please. Mama, please.
Thank God you're here. Do the needful.
Mama, please, just 3 weeks
Madam,
now.
why did you invite us to come help chase your tenant now?
This is a civil matter now.
Is this a movie? If it happen,
If we follow
The new police law.
Welcome back and thank you for staying with us. I'm still here in the studio with Dr. Adebi Olusegun, and we're talking about the Nigerian healthcare system, how we can manage the Nigerian healthcare system despite the challenges that we are facing. And so I said before we went on the break, we're going to talk about the exodus of Nigerian doctors out of the country. It's no news that Nigeria has one of the best stock of doctors, honestly.
Definitely.
And most definitely, if someone is coming to take them out, it actually means that they're actually good. Someone actually does see potential in them. Yeah, and having this issue of doctors actually leaving is a major deal. It's a big deal. What do you think? What do you have to say about that?
Okay. Before I go into that, I would like to tell you and the viewers some things. One, a lot of people don't realize it, but we've not graduated up to 150,000 doctors in this country since inception.
So when we say inception, do we say 1960?
Since when we started graduating medical doctors in this country, we've not graduated up to 150,000. And mind you, out of that number we have graduated, some of them are dead. Some of them have left the country. Some of them are in the process of leaving the country. And some of them, before the end of this year, a lot are going to leave the country. Some of that number have gone into politics. You have your Bukola Saraki, Dr.
So many of the doctors that actually
Dr.
go into politics.
They've gone into politics, so they're not practicing. That's still out of that number. I saw an article by the NMA, I think that was last week, saying that actively we have, give or take, about 42,000 active doctors in the country at the moment.
42,000?
Yes. Put that figure on one side and now consider this. We are a population of over 200 million. Put that figure aside too and now consider this. WHO believes that standard, there should be one doctor to 600 patients.
People.
Now, do the maths. It tells you the average Nigerian doctor is overworked. The average Nigerian doctor is stressed. In view of this, let me also tell you this. There are some doctors in this country that are being owed 18, 19 months salary. Put that on one side in your mind. Now combine that with the number of patients ascribed to this doctor based on 42,000 doctors seeing over 200 million people. And some of our doctors have been working for several months without salary. The new doctors, new intakes into the medical profession, the house officers, there are some of them that have been working for the past 4 or 5 months. They've never even collected salary before. They've finished school, they've graduated as doctors, they've started working, and have never been paid once. This is the 5th month now, which is part of what the Nigerian Association of Resident Doctors as a body is trying to sort out. Put these aside. Whether you like it or not, Some of our colleagues have moved out of the country. But you go to the US, you go to the UK, you go to Australia, you go to Oman, you go to Dubai, you go to Saudi Arabia, you meet Nigerian doctors. You think these people don't relate with their colleagues in the country? They do. Whether you and the world is a small place because of social media, because of the internet. When you see how these your colleagues are doing, you are encouraged to leave the country. I talked about my brother that is in Saudi Arabia. The other day, he came back into the country, came for vacation. He hasn't seen everybody for a while. Came for vacation. He was in Abuja with me, and he talked about he doesn't have loose change. That where can he change dollars? So I took him to Zone 4. He changed right there in front of me. My brother, my junior brother of 4 years, changed $1,000. And what he called it was he needed to have loose change. That $1,000 is more than my monthly salary. And I'm not just any doctor. I am a civil servant on grade level 15 as a doctor. That money he changed for loose change is more than my salary. And you wonder why doctors are leaving the country. It has reached a point amongst ourselves when we are talking and you see someone that doesn't want to leave the country, you tell the person, don't you think you should go for psychological evaluation or mental whatever. If everything is happening like this and you still decide, it's one thing you are trying and it's not working, then it's another thing when you now say you don't want to leave. People look at you like this, there must be something wrong with you. So it's the state of everything. Everything we've been talking about since boils down to this. It's the state of everything. Even if you put the issue of remuneration aside and being encouraged to stay back in the country and work, consider the equipment you have to work with. You get? Consider the equipment you have to work with, because if the equipment you need are there, the stress you would go through to do your work will be reduced. It will be reduced. You don't have to, like now, you go to advanced countries, they bring a patient in, there are investigations you run for this patient to find out what's wrong with the patient, and these results come out on time, so they help you make your diagnosis on time. But the thing with Nigeria is this: you bring a patient to meet a Nigerian doctor, all he has is his brain. He needs to start thinking, okay, for this person to present with this, do you also have this? Yes, he needs to start doing plus and minus in his brain to try to find out what exactly the problem is. It's stressful. Now consider the fact that he gets to see more patients than the doctor in the advanced setting. Considering the fact that that doctor has just 600 patients according to WHO to attend to, while the doctor here has about 5,000 patients ascribed to him alone, and he has to go through that same process for 5,000 patients if he gets to see them. So whether you like it or not, you would want to leave, because there's nothing encouraging you to stay back. Nothing. But the equipment, remuneration, nothing. Then the country as a whole is a problem on its own. You think about security. About 2-3 days ago, we heard news that a doctor was kidnapped on the way back from the Benin National Executive Council meeting of NMA, going back to his base. He was kidnapped. The kidnappers are demanding 100 million. Because apparently everybody sees doctors differently from reality.
We actually think that you have money.
No, we don't. We do not. It's a sad situation.
As sad as the situation is, there's something I would still want to, because Nigeria is our country and always want to salvage the situation. And on this platform, and I would still like to say, you're smiling already. Patriotism is something that we have to all imbibe. It's difficult for all of us, we all know that. But honestly, if we all leave, who is going to do the rest of the work? You know?
Can I say
Yes.
I'm glad you talked about Nigeria as our country and all that. Somebody needs to remind our government officials that Nigeria is our country. We have no other home. This is our home. Somebody needs to remind them. If you don't make your home better, if you don't make your home habitable, where do you plan to stay? Where do you plan to go? No matter where you go to, that place can't be your home. You will always be seen as an alien. It can't be your home. And part of why I said they need to be reminded is you hear utterances from members of government that should take care of us as Nigerians. And it shocks you, it saddens you. From where I sit, it looks hopeless.
We still have to give our hope to people. Well, thank you very much, Dr. Olusegun, for taking out time to be here with us and bearing out your mind and still reminding all of us, and even those in government and those in leadership, that Nigeria is ours and things have to be done better. Well, thank you very much for taking out time to be here with us. And we hope that next time when we call, you would still take out time.
Definitely.
Thank you very much. Well, that's the size of our package today on health and well-being. Do remember that Nigeria is ours, and all we have to do is be patriotic and stay true to who you are. Thank you very much, and do keep it to date with us same time next week. I am Lois Appa Sambo. Do stay safe.